So when you get the artificial tears, they are helpful, but they are not the true story. And you want to be evaluated to see if you have any underlying diseases, if there's any malfunction of your lids, if there's something going on with the oil glands, if you would benefit from any of the prescription medications, and to see if you have any injury to your eye that needs to be addressed, because you can actually have some corneal melting in very severe cases. You can have abnormalities of the eyelids that can contribute to the dry eye. And again, the systemic diseases that we would want to evaluate. So we take dry eyes very seriously. It is not something that we take lightly. So if you are concerned that your vision doesn't appear stable, that it's sort of smeary, you have burning, watery eyes, sandy, gritty feeling, then definitely get in to see your ophthalmologist so we can give you that complete and thorough eye exam to identify if in fact you have this, and if hopefully you'd be successful with some of the treatments. There are many things that we can do depending on the type of dry eye that you have. If your dry eye appears to be more inflammatory, meaning you have a decreased tear layer, your tears are quite thin, then there are prescription medications that are currently available that will decrease the inflammation, not infection, but inflammation on the surface of the eye and try and jumpstart the production of your tears. So it will allow the eye to produce the tears that it can. So it is important that these medications are started in a timely manner before all of the necessary equipment that the eye needs to make the tears has been destroyed or damaged. So that's one medication. There are therapies that are targeted towards the meibomian glands, the oil glands in the lid. With every 4-second blink, you're releasing that oil. And so using heat, we recommend that patients use heat for it. In order for it to be meaningful, as I tell my patients, it has to be 20 to 30 minutes. You can use hot spoons, you can use some of the masks, but it's 20 to 30 minutes of sustained heat. Not enough to burn the skin, but enough to feel warm and to hopefully begin to melt some of the oil. It will melt the oil, but it won't take that clogged oil out. So there are treatments that will not only heat the lid, but with thermal pulsations, they will clean out those oil glands that are stuffed with oil. There is also a laser treatment that was discovered by dermatologists who were using that laser for acne rosacea. And so in the treatment of that with this laser, they noticed that patients who also had the manifestations of acne rosacea in the eye improved.